Hello, hello. I, Dr. Shannon Clark here. I'm waiting to be joined by my guests for a live discussion. Can one of you guys that just joined let me know that you can hear me okay? Just give me a thumbs up, please. Okay, we're just waiting for the guests to join. There we go. Waiting, should be coming soon. Hello, hi there.
How are you?
I'm doing well. How are you? Are you working today?
I'm
Yeah.
working and literally fighting fires.
Oh, oh, hold on. You're frozen. Hold on just a second. Oh, wait, wait.
So
You
yeah,
froze up
it
for a
was
second. No, I was saying you
yeah.
froze
I
for a
had to put
second. So
my
there,
AirPods. Yeah,
yeah,
go
okay,
ahead.
okay. That's okay. So you froze for a second, but I think you were saying there was a fire alarm and you were trying to get to your office. Is that right?
Yes.
Yeah.
So yeah. So if I'm a
Okay.
little bit sweaty and out of breath, it's because I did the stair challenge today. So
Awesome, awesome. Well, I was just going to introduce you. This is Dr.
great.
Stephen Goudy. He is a pediatric ENT with a joint appointment at Emory University and the Georgia Institute of Technology. We also went to the same college, undergrad, I found out. And where did you go for med school?
Same place you did.
Same medical school, right? So
Yeah.
Center College in Danville, Kentucky for undergrad and University of Louisville for medical school. So we have that
Yeah.
connection there. So I'm
That's
super
right.
excited to have you on today. I don't get to have a lot of discussions about pediatric things, so this is always exciting for me. But what we're going to talk about today is just all the upper airway junk that kids have when they're little. I know I had twins. One of them didn't really have an issue. The other one did and ended up getting tubes in his ears, and we'll talk about that. And then we'll go through a product that Dr. Goudy has that I really think is really cool, and we'll talk about that at the end. So let's just jump right in. Let's start from when the baby's first born. Now, we've heard about vaginal delivery versus C-section. When the baby's in utero, there is amniotic fluid in the baby's lungs. And the process of vaginal birth helps to compress the chest cavity to help expel that fluid out of the baby's lungs. With a C-section, might be some of that to a certain degree, but not as much. So explain why that happens and what the potential consequences are for a C-section. Does that make
Right.
sense?
Yeah,
Yeah.
absolutely. I think that's very relevant to your field and my field, kind of
Yeah.
where that handoff happens. And
Mm-hmm.
I would say I appreciate being here because a lot of times some of the most exciting things I do are working with OBGYNs on babies that are
Mm-hmm.
having complicated issues. But
Yeah.
certainly in this simple instance, obviously as babies are being born and going through the birth canal, they get squished and, my kids' heads came out all different
Mm-hmm.
shapes and sizes.
Mm-hmm.
And that pushes the fluid out of their airways, out of their lungs, because they go from not having to breathe air at all and get oxygen because they're getting it from mom, they're having to do it all on their own. And
Yeah.
so any residual fluid, whether it's in the nose or in the lungs or in the ears,
Mm.
can cause issues. And certainly as soon as the baby's born, they're suctioning them out using
Yeah.
something like this, right? And they just,
Yes. Yeah.
you're not the one doing that, right? You're kind of,
Well, we do a little bit of it right at delivery, but mostly in a C-section. But other than that, where I work, we deliver
right,
the vaginally. The baby gets handed off to the nursing staff or the pediatricians,
right.
whoever's there, and they do all that. But yeah.
Right, right. But anyway, so you're getting this and kind of cleaning out
Mm-hmm.
the boogers, the upper airway. So babies have to figure out how to breathe immediately. That's why they spank them on the bottom or whatever they do these days and get them to breathe, to stimulate, to open up the airways, to clear, to exchange
Mm-hmm.
oxygen. And if they have a lot of secretions or boogers, then that's hard for them. And babies
Yeah.
have to breathe through their nose anatomically or structurally.
Yeah.
That's, their voice box is super high and it almost interdigitates or kind of sits right on that little uvula,
Mm-hmm.
or you're from Kentucky, I'm from Kentucky. We call it the vomiker, right? So if you touch it,
Mm-hmm.
you vomit.
Yeah.
So really and it's structurally their bodies are such that they have to breathe through their nose
Yeah.
and kind of getting into the later parts of our discussion, just from the very moment that you come into this world, if your nose is not clean, you can't breathe for the
Yeah.
first year of life. So
Yeah.
that's
Yeah.
really, so for patients that have a C-section, they may need a little more suctioning.
Yeah.
They may need a little bit more time to have the doctors, the neonatologists or the pediatricians help them get all that stuff out of there.
Mm-hmm.
Yeah, so I think that's incredibly
Yeah.
important.
Yeah, so but I think most people, or not most people, some people don't realize that when the baby's in the uterus, the lungs are filled with amniotic fluid. That's amniotic fluid is essential for lung development, but obviously the baby can't breathe until the fluid is out of the lungs once the baby's born. So that's why you will see the suctioning, and you might require more, or the baby might require more attention after a C-section than after a vaginal delivery. So that's typical. So you did mention briefly, you talked about
Yes.
the anatomy. So I have my questions here. So
Good.
the upper airway anatomy of newborns and infants. Let's talk about that, and why are they considered obligate nose breathers? Okay, and why? And when does that ultimately start to change to where they're able to breathe out of their mouths? That's kind of three questions.
That's okay.
So let's talk about the anatomy first. The anatomy first.
So anatomically or structurally, everything that God, Yahweh, Buddha, whoever you believe in, intended for there to be in general is there.
Okay.
It's really tiny. We're all born with sinus cavities. We're all born with bumps inside your nose called turbinates. The adenoids, which is tissue at the back of the nose, is very, very small when the baby is born. But because when babies are born, they have to breathe and eat at the same time, the voice box and all that really sit almost together. And so that they can breathe and eat simultaneously. But as the baby grows older, over the first year of life, the voice box comes down, and so they can kind of eat, swallow, and then breathe. And so that suck, swallow, breathe rhythm, and again, anything disrupting that, particularly at birth, can cause feeding problems because, if you have to choose whether you're going to breathe or eat, breathing is more important. So structurally, all of the pieces and parts are there. They just change the location, and the voice box it kind of descends, if you will, and that changes the breathing and eating pattern or rhythm. But as you were discussing, right after birth, they have to figure out breathing, shortly thereafter eating, and so on. So does that answer your question?
Yeah. So for example, we know that when babies are bottle feeding or breastfeeding, they have to still breathe through their nose and eat at the same time. Whereas as we get older, we can kind of all do that, or we can hold our breath longer. Babies can't do that, right? So if where we're going with this is if they start to get upper airway congestion, it's going to affect their eating. I had that a lot with my son because whenever he would get a little virus, it would always go into his upper airways, his ears, and it was a problem with getting him to eat because it's hard to eat when you're all congested as a newborn and infant. So that kind of directly plays into the role that having these infections or viruses when you're little can affect, causing dehydration potentially if it's prolonged, right? Because they're not able to drink. So that's why it's very important to pay attention when your baby does have that upper airway congestion. Does that make sense?
Yeah, no, that's exactly right. I mean, that's a huge pain point, and it sounds like you and I and probably a bunch of people watching us today have been in that. Yeah. And for whatever reason, it usually happens about Saturday night at midnight, and so the pediatrician's office is closed, and they have a high fever, they can't breathe, they're angry, right? So if they can't breathe, they can't eat, they're not going to sleep, you're not going to sleep, and so it's this vicious cycle. And so really nasal hygiene is hugely important in the first year of life from the very moment that you're born. And each of us, even though as we get older, we get sick less frequently. And in the last year, because social distancing, hand hygiene, wearing masks all prevent viral infection, you're like, okay, I haven't been sick. I've actually been breathing fine. But, if you think back when you had a bad cold or you had the flu, half of the misery is you can't breathe, right? And then you can't sleep and you wake up tired because you're literally panting like a dog and you can't get comfortable. So it's hugely impactful
for little babies. So what are some of the more common things that, we'll talk about newborns and infants, age 1 and under. What are some of the more common illnesses that these kids can get that causes the upper airway congestion?
So viral, go ahead. I mean, so to your earlier question about the structure, obviously, if your baby is born and can only seemingly breathe out of one nostril, then there may be something that didn't form exactly the right way. So you can either have a cyst in the nose, or you can have a persistent membrane or tissue. The anatomy is pretty interesting. And so you can have something called Coenol atresia, meaning one or both sides of the back of your nose doesn't form right. And so
if that's the case, when a baby's breathing, would one nostril collapse and the other one doesn't? How would a parent know? So how would a parent know that could potentially be an issue?
So if you have a blockage on both sides, then immediately after birth, they're going to have a
Right.
whole lot of trouble, and they'll be in the neonatal ICU,
Right.
and the doctors will be trying to sort out, is there a
Yeah.
direct blockage or is it something lower in the airway, et cetera. If your baby is doing okay and then goes home, but you notice that when he or she sneezes and boogers only come out one
One
side,
side. Okay.
or something of that nature, like, okay, I just don't see anything coming in or out of this one side, then
Okay.
you have to worry, is there a structural difference?
Gotcha.
And have a ENT doctor or a pediatric ENT doctor take a look and see, is there something structurally different? To get to the much more common thing is that your babies get colds. And so I'm sure that you've covered this, but the babies are born with mom's immune system. So that's why it's really important that moms are looked after, have all their vaccines, all that stuff, because you're protecting your baby for 6 months, right? And there's nothing that's more precious to you than your little baby. And so providing that protection through, as best access you can to vaccines, et cetera, is important. And then over that 6 month to 12-month time, they're really developing their immune system. And so they're going to get sick a lot, but that's important, because then, when they get to kindergarten, they've already had all of the colds and so on. They don't miss school as much. But 6 to 10 colds a year, viruses, is common. So if it seems like they're sick, I mean, I'm sure you've been through this. If they're sick every it's like, okay, they just got over X and now they have Y or Z or what have you. So it's painful and it's hard, but understanding that number one, it's good for them and their immune system, and number two, figuring out the best way to keep them healthy and breathing and eating and kind of working through it is kind of what we recommend.
Yeah, I think that as a physician, I realized that part, but having twins and they never got sick at the same time, of course. There was at least a 3-day delay between my son would always get it first, still to this day, and then my daughter 3 days later once he was getting better, every single time. But when they're little, and it's much easier to handle now that they're older, but when they're little, it's so scary because you can hear all that in there. You can hear it in their chest and their nasal cavities, and you're listening and you can't sleep. The baby's not sleeping. So, knowing when to, talk to your pediatrician, make sure you understand, how to call them at different hours of night, what the wait time, what things to bring your child in for, when it's appropriate to go to urgent care. Having those conversations with your pediatrician's office is so important, for me, and we can go into my experience with pediatric ENT because I'm still experiencing it with my son. He would get the normal infections, like you say, as a child, infant, 1 year and older, but they always went into ear infections. Always. He had, I'm trying to think, in the first year, probably 4 ear infections. By the time he got tubes at 18 months, he was up to almost 8. So what is it about in some children when they get these common colds that it's causing them to have ear infections? Because my daughter did not have that. She had the same illness as he did. She didn't get the ear infections. He did. So is there something about some children that makes them more prone to the ear infections?
So that's a great question. I would say yes. I don't know if you or anybody else in your family had a lot of ear problems growing up, but certainly there's a good component of heredity. I mean, identical twins have a very high likelihood of having the same ear problem. So there's some hereditary structural issues, but it's also really common. I think if you get colds a lot, so about 10% of the time they're going to turn into a sinus infection or an ear infection. Just kind of on a personal note, if you do the research, most ear infections are viral in nature. So if you have a cold, it's a virus. Most ear infections are viral. So if you live in Europe, they're going to say, yes, you have a infection. It's mostly viral. You don't need antibiotics unless you're kind of you're really young and there's a really high fever, you're immunocompromised, whatever. So that would be the one thing, is that's just an extension of the virus. So exactly how your ears work. So you have something called the eustachian tube. So it's a tube that connects the back of your ear to the back of your nose. So if you've ever had a bad cold and you're like, oh, my ears can't pop, it's because that tube isn't opening and closing well. The way that it opens and closes is that the muscles in the palate are kind of back by the vomiker that we talked about earlier are the ones that contract and pop your ears. So that's why when you're on a mountain or a plane, you chew gum, because it makes those muscles open or work and pull against each other and open up that eustachian tube. So when that tube isn't opening because it's swollen, then the pressure
Gets
doesn't
trapped,
equalize. Yeah, the fluid gets trapped and it turns into a cesspool. It's like, you know, like a tire that's in your backyard that collects mosquitoes, right? So
Yeah,
if
yeah,
that
yeah.
water doesn't go away, then you get the same thing. And then over time, for your son, I mean, guys are more trouble to begin with, right? So,
Okay.
you know, but the stuff that's behind his eardrum is actually something called a biofilm. And so that's, you have these very slow growing bacteria that make these big mucus coats that sometimes it just won't even go down that tube, and it's just stuck and you have to clean it out. Does that answer your question?
Yeah. I mean, I think,
Yeah.
you know, the best explanation I heard is that sometimes with babies, what you just talked about, the eustachian tube, is not working properly to allow the equilibration between where the congestion and it gets trapped in that eustachian tube. It's sitting there long enough, it's going to turn into an infection. Whether, for example, you said most of these upper airway diseases in babies and infants are from viruses, but that causes the congestion. But if the fluid gets stuck in the eustachian tube long enough, it will turn into a bacterial infection. So that's why you might go in initially with a virus and they say just wait it out. But then after so long, if the child is starting to have signs of an ear infection and having the fever, they might start antibiotics then. And it's so hard. I remember I was like, why don't you just start him on antibiotics now, please? But I get it. You know, you want to do the right thing, and you can't. We have enough antibiotic resistance. We don't want to keep treating kids with antibiotics just for everything. But it's hard as a parent to wait it out.
Watch them and like, because our lives, you know, we're so scheduled in shape. 10 minutes at a time brought 5 minutes to leave seemingly worth it. So, I mean, when parents are all things, as far as the risks that we do, kind of like what you had is for infections, that's infections months or infections a year minimum, or fluid that's behind the ear or longer with a hearing loss. So certainly it can affect speech. I mean, anybody that's had a bad cold and you can't hear very well, I mean, you know that it's going to affect your hearing to some degree. So it's, I mean, it's something that requires ongoing medical attention.
Yeah, so. he would get and ear infections cause a high fever, which is also hard to watch when you're a parent, when they're little. So he would always get those 103, 104 temps, and it was excruciating. But we're over that now. His tubes ended up coming out, but he's 4.5. But he still has a little bit of issues with one side, but we'll see what happens. Okay, so now let's talk about these times that we're at home. The baby's all congested, especially the little ones. They're having trouble feeding, and it's not bad enough to go to the pediatrician, or it's the weekend, or it's the night, and you don't want to go to the urgent care and sit for hours, or in a pandemic and sit for hours. What are some of the things that we can do as parents at home to help alleviate that congestion? Let's talk about just what we can do physically to help alleviate the congestion, all the way to the other conservative measures. And there's a lot of comments here about humidifiers, the warm versus the cool mist humidifiers. What are some of the things that parents can do at home to help?
Well, I mean, hopefully during the pandemic, you know, there's not been as many colds, right? So because people are social distancing and hand hygiene, all that stuff is good. I'm not saying that, you know, that's not important, but if your child does have a cold or just has congestion, I think the humidification is important, both saline drops in the nose. And again, obviously working with your pediatrician. I am a pediatric ear, nose, and throat person, so I have a very specific, narrow focus and deal with the nose a lot. Having said that, I don't replace anybody's pediatrician. So developing that relationship. But if you were to come to me and say, hey, my baby has these issues, I would say saline, you know, a couple drops in there, let it moisten up, and then physically suck the boogers out, you know, and there's a whole host of different things that are on the market that do that. The humidification is important. So I would say that humidifiers are important. You know, it just loosens up things. You need to be thoughtful or careful about it, just because they're hard to clean. They have mold. You know, you don't want to walk in and like the floor is wet, or you know. So there's an optimal range of humidity. It's between 40 and 60%. So it's hard to tell that, but you can buy humidity monitors or sensors and really say that. But you know, because if a baby has a cold, they need more humidity. But if you get too much, then it won't cause asthma, but it certainly makes certain respiratory conditions more
So
difficult.
is there a difference between the cool mist versus the warm mist humidifiers? Is one recommended over the other? I get that asked all the time.
Yeah.
I don't know. And I've honestly looked to see if I could find an answer, and I've never found an answer that I thought was good enough. So I don't know what's better. I didn't use either. I just used a humidifier. It wasn't cool, really not cool or warm mist. It was just putting moisture into the air.
Yeah, I mean, I think quite honestly, you know, so putting humidity in the air will make it cooler. That's just the physics of it. Personally, in the hospital, we don't use warm or humidified air in general unless we're having to humidify a tiny baby who has as you know, temperature regulation, other things of the newborn is huge, of huge concern. But if it's your 6-month-old, 10-month-old, 12-month-old, I don't know of any data that would suggest that warm humidity versus cool humidity has any significant advantages. I would say mold loves a warm, moist environment, so that is a consideration. I think it's more the humidity than anything else that really is helpful. And it just keeps, because if you think about the nose, it's small to begin with, and then you have these little tiny sinus cavities and so on. And so you want a free flow of that mucus not to get stuck in there, because otherwise then the mucus gets backed up and they can't breathe and they get sinus infections and all that kind of stuff.
Yeah, I agree. I don't use anything warm, and that's probably the doctors in us, because we're kind of taught that the warm plus wet is not good for sickness. So I don't use the warm, but I haven't purposely bought a cold, what's called a cold mist. But I can tell with the ones that I use that it is cooler. Plus, we keep the house, the home cooler. That's another thing too. When kids have a lot of congestion, you don't want it too hot. I noticed with my son that when he would get warm or hot, he would cough more, he would have more congestion. So keeping it on the cooler side is ideal as well, as far as the temperature in the home. The other thing that, as Dr. Goudy just said, you gotta clean that humidifier. It's very important that you don't let that water sit there and then use it later down the road. If you're needing it for your sick child, make sure you're cleaning it daily so that it doesn't get any bacteria or mold or anything like that in there. I know I was using it for my son and I forgot to take the water out, and I saw firsthand what it can do when it sits in there, and I was like, okay, we're gonna get a new humidifier and we're gonna clean it. So as much more diligent about cleaning. Yeah, it is pretty gross. It's pretty gross. Okay, so now one thing I want to talk to you about is that you have, let's go back. When you go to do your baby registry and you go to Amazon, which most people do, there are a gazillion products for suctioning out snot, boogers, congestion. I know when I had my twins, the nose Frida was the big thing, and that's where and I'm sure most people watching know that you put the suction on the nose and then you suck it out and it pulls stuff out. Right. I mean, or you could just use the regular bulb syringe suction like you said. I mean, there's multiple things that can help. None of them are perfect, but you actually developed a product called the Nosebot. You actually sent it to me, and I love it. And I'm going to pass it on to my best friend who's going to have a baby soon. Oh, good. Let's talk about, first of all, why did you see the need to develop the product? Do you have it with you? Do you have the box with you?
I've got the bulb syringe. I got the Nosebot here.
Let's talk about, so what was it that made you feel that, or think that there was a need for something like this on the market?
Well, I mean, literally, I'm in people's faces all day long, right? And talking to families like you and some of your listeners and say, okay, I don't want to suck my own kid's boogers. Or, I mean, one of the most poignant moments was I was in the hospital and taking care of a sick child, and the mom looks at me and is like, I don't need you. I just need the suction that's on the wall, and then I can go home. And I'm like, well, that's actually a great point, right? And so, if we're willing to pay $1,000 for an iPhone or whatever, whatever that it is, we will, we want better solutions. And why are we using, something like this that occupies your whole hand? And then, when your kid gets older, they see you coming with that, they're going to run. It's like trying to floss the tooth of a saber-toothed tiger or something. I mean, you just can't do it. So really identifying as a curious person and an expert, my wife's like, look, why are we doing this stuff? Why am I sucking my kids' boogers? I mean, that doesn't, there's not an N95 in those mouth suction devices, right? So you're, and there's a lot of folks that have told me I get really sick when I do that, which makes sense because, so the one thing we didn't discuss, the upper part of your face acts as a filter to kind of trap all of the viruses and
But yeah.
bacteria. Yeah, and really warms and humidifies the air. So, you know, for you and me, if we're sucking that stuff, we're basically vaping viruses, whatever that virus happens to be, whether it's adenovirus or coronavirus or what have you. So it's going directly into our lungs. So we developed the Nosebot, which is a device to address that pain point. So I don't, you can see it here. So it's you've seen it, but it's portable, rechargeable, you know, has 1, 2, 3 levels of suction. And so really the unique part is that you can put this thing on your fingers so that you can hold your baby's head. So
so like that, like this. Yeah.
So here's baby. You're like, okay, well, first time it's like easy and the baby's smiling and really happy. Second time the baby's doing this and you're like, you know, and you're like literally like, you know, I mean, there are pictures on the internet of, you know, holding your baby in awkward positions to clean out their nose, right? Or sitting on them. And nobody, you know, one of the many things that parents that, you know, other parents don't talk about is like, okay, what are the gross, terrible things you have to do to help your baby? And one of which is sitting on them literally to suck out their nose and be done with it, you know, in a manual way. So yeah, I mean, we're with this device, we're actually giving you a whole hand back, right? And so you can hold their face so that, you know, you're not suctioning out their eyeballs. And with the other hand, you can hold their arms and their legs and everything else. So it just should be, parenting shouldn't be this hard. And I was reading an article recently, and the article really put it in a great way. They described it as moments of silent suffering. And so you as a physician, me as a physician, me as a parent, you as a parent, we want to alleviate silent suffering for ourselves, for other people. And so that's the goal, is to give you a best-in-class hospital-grade suction that's portable, rechargeable, and addresses a pain point that you're using. You know, this is probably 1900s technology. And why you know, why do we send you home from the hospital with that if we know, you know? So.
Yeah, well, I mean, I think so with the Nosebot, when you put the suction into the nostril and you have the different levels, are there instructions as to when to use what level? When they're a little smaller, do we do this? Obviously, it's probably the lower suction, and then as they get bigger, we could do a higher. So where does the snot go? Show me where does it go? Yeah.
So here it is, right? So it looks like a little airplane, you know, I mean, and then so this part will come off. So just, you know, and then this part comes off. So you just wash that out. There's a little filter here that just keeps it from going in the tubing, because everybody, you know, I mean, if you, the breast pump, folks, I've cleaned out a lot of breast pump stuff, and you don't want it to get in the tubing. And you know, just take this out, throw it away. And then this, let me just pull this other part off. And so the back end comes off, and you can just throw all of these parts in the top rack of your dishwasher, and then go for round 2. So it makes it, you know, we've gotten a lot of feedback that is encouraging. And, you know, interestingly, they're older kids. So your son may actually like it. There's like 4 and 5-year-olds are like, okay, I like it. I just shove it in my nose. I don't have to blow my nose. Because kids don't really figure out how to blow their nose until they're sometimes a lot older. So, so I think we make it more efficient. It can fit in your diaper bag.
Nice.
You know, and think about grandparents too, right? They don't want to be using this other stuff. I mean, you know, if your kid's an asymptomatic carrier of COVID-19, which, you know, they're going to probably do fine, but then all of a sudden grandma or grandpa is using a mouth suction device and inhaling COVID-19, then that would be a bad feeling.
That's true. That's true. Yeah. So Dr. Goudy is on Instagram at Dr. Nosebot, and I will put all this in the caption here, so you can go follow him on Instagram. But he's been gracious enough to let us know that we're going to have a discount code, $20 off. If you, and I'll also put the link to the website for the Nosebot using code BABYDOC. And I'll put all the information in the caption so you guys can go there, check out the product, and order it if you want. It is a little bit more, it is more expensive than the Nosefrida. But I can tell you, after having looked at it myself, I do think it's probably going to work a lot better. I haven't used it personally because my kids don't need it yet. But I have looked at the demonstrations, and I really like this product. So try it, get the $20 off, and see what you think.
Oh, so the one other thing.
It
is HSA and FSA eligible. So so just so it reduces that.
So that means they can fill out that paperwork and get some more, get it covered. Is that right?
Yeah. Yes.
Or
if they have an HSA, FSA account, they can just buy it directly through their account. So.
Oh, that's awesome. That's awesome.
Yeah.
Yeah, no,
Yeah.
I didn't ever even thought about that. So that's excellent. So another
Yeah.
plus. And also you can go to his Instagram account and get more information just about things in general. So
Yeah.
go support him on Instagram. So let's go through and answer a few questions because I see some.
Yeah, and I would just say we plan on being a content forward company. So Dr. Knows Best will teach you about the health and wellness space, and so answer questions about sinus infections, croup, ear
Yeah.
infections, all the stuff. So a lot of the stuff we covered today. So I want to exactly what you're doing. I want to model what we're doing after you and provide evidence. I mean, it's not my feelings, it's evidence, and parents shouldn't be Googling what to do when my kid has a cold at Saturday night at midnight. They should know to, come to my website and I'll tell them what the evidence is, or if they have concerns about premature contractions or whatever, they'll come to your page. So.
And one thing you could also do is go to his Instagram and just send, talk more about this topic. That's how I get a lot of the information that I talk about. You could always go to Dr. Goudy's account and let him know, hey, can you educate on X, Y, and Z?
Right.
And that's a great way to get content ideas. Okay. Oh, so this was just a question about where to go. Will buying an air purifier help my baby's congestion? So purifier is going to be different than a humidifier. Air purifiers, and I've done some research into this because I have one in my home. You got to really look at what kind of studies were done with the air purifier, because you can get a gazillion purifiers on Amazon, but not all of them went through studies. Unfortunately, the ones that actually went through studies are going to be more expensive. But I will say I stand by the air purifier that I have. I don't know that it helps so much with getting infections because we've been in a pandemic. My kids haven't really been sick. So the real test is going to be once we start opening up and seeing how it helps with the household. So do you have a particular opinion on air purifiers and whether or not they help with diseases in the home?
So I think that the diseases, as you just said, the diseases that you're most likely concerned about are viruses. So hand hygiene, vaccination, all that kind of stuff is going to manage some of it. But again, once we go back to being in person, you're going to get colds and upper respiratory tract infections, and it's painful, but it's helping your baby's immune system develop. So I'm not saying I encourage people's families to get sick. I just don't think that most of the burden that you're going to find really has to do with your house. What you are reducing in your house are allergens. So, and kind of colds versus allergies, that's a whole different topic we could spend an hour on. But in general, because if your baby's young, their immune system's just developing. So they're not really been exposed to several cycles of pollens and or molds or cockroaches or dust mites, etc. But yes, the air humidifier the air purifier will clean some of that stuff up. Yeah, the air purifier will clean some of that, particularly pollen and all that for sure.
Yeah, so I think we just have to remind parents that while having these viral infections as an infant, especially one and under, is never fun. It's actually helping the baby's immunity, and they happen for a reason. Of course, knowing when to be concerned and when to go to the pediatrician is always important. But there is a benefit actually to kids having these viruses and these viral colds. It does help build their immunity. It's just hard for us as parents. They'll never get sick. But the reality is they need to get their immune system, because even breastfeeding can only protect so much through passive immunity. They still have to be exposed to the world and what's in it in order to get their immune system robust, as you would say. Right. So this is a question. It says, I tell my baby's doctor since birth I'm concerned about his congestion, but the doctor always says it will go away. I'll give my opinion. You can give yours. My opinion is this. If you have any issue with your child and you are not getting the response you like from your pediatrician, you can always ask for a referral to see the pediatric ENT in this particular case. There's nothing wrong with that. Or ask for a second opinion. There's nothing wrong with that either. If you don't feel like you're being heard or you're still concerned or you're not happy with the response, you can ask. I've asked before. So what are your thoughts on that?
I'm a super specialist, so by the time they get to me, they've already gotten that referral. But when moms or dads or caregivers come in and they have a intuition or they feel like something's wrong, it is my job to be 100% sure that I'm not missing something.
Right.
Because there's almost never an instance where the family's like, I want my kid to be sick, and I'm here.
Yeah.
You know, I drove all this way and I paid a copay,
Yeah.
and all of the frustrations. So there's typically something going on. Whether you know, and again, the pediatrician sees so many babies that they know 99.9% of the time that things are going to be self-limited. And the great thing about working with kids is despite what you do, they often get better regardless. Yeah. So I think they also have an intuition, but if your intuition and their intuition don't match,
yeah.
you need to be sure that you find the right person. And sometimes that might be going to a specialist and the specialist telling you the same thing.
Yep.
And then you're okay with it or maybe not. So I'm like you, just get to the next level if you feel uncomfortable, because it is your most prized possession. And
I mean,
we believe you.
I think the message here is it's okay to not agree with your doctor and what they say.
Right.
You have to rely, as Dr. Goudy said, on your intuition, and it's okay to ask for a second opinion, and it's okay to ask for a referral. It's okay. If you're not happy with the response you get, it doesn't mean you don't trust your pediatrician. Sometimes you're just not on the same page, and that can happen. So there's nothing wrong with asking for that next level or that next step. And this question here asks, any correlation between polyhydramials, which is increased fluid in pregnancy, and increased need for suction at birth? No, I mean, the amount of, just because there's an extra amount of fluid in the uterus doesn't mean there's extra fluid in the baby's lungs. There's only certain capacity for that. The more thing with polyhydramials has to do more with once delivery occurs, there could be some hemorrhaging in mom. But I've never seen anything that says the polyhydramials was, the AFI or amniotic fluid index was 42 and the baby had a lot more fluid in the lungs. So I don't know that that's a real correlation. Let's see. Switch from breast milk to formula, and now he says. Let's see. My preemie was switched from breast milk to formula, and now he stays congested or has started to produce a lot of mucus. What can I do for that? Well, you take this one. What do you think?
So I think some of it depends on how old the baby is and whether they have reflux or not. And so all babies have reflux. I mean, my kids had terrible reflux, but that's normal. Again, if you eat a steak dinner and drink a bottle of wine or whatever it is, and you lay down, you're going to feel reflux too. So all babies have reflux. If your baby does have that amount of reflux, it can get up in their nose and cause them to be congested. So that's something to consider. You can have food allergies, and so then that can cause there to be congestion and so on. And certainly that may play a role in some of the congestion you're hearing. But in general, if your baby has food allergies, then there may be other signs, pain, constipation, diarrhea, all that kind of stuff. But that really is beyond the wheelhouse in general that I have. I would say the other thing that we talk about, or at least my kids have gone through, is if they're breastfeeding or getting breast milk and mom is drinking dairy, sometimes that causes some congestion and some other GI side effects.
Yeah. So it's not easy. It's not easy. I remember going through those times where I'm like, and what I'm doing to help making it worse. Right. I mean, it's hard. It's hard, but I think, trying to keep the airway, the best thing that I tried to do was try to keep the airway free of congestion. Did the humidifier work? I even put baby Vicks on the chest, it was what my mom said to do. I don't know if that worked, but the only thing that did help, and sometimes it was multiple times a day, was actually really trying to suction out and clear those passages to help the baby breathe. That's probably the one thing that bothers them the most when they have all that going on, is not being able to breathe. That makes them more cranky. That doesn't allow them to sleep, doesn't allow them to eat, which makes things worse all the way around. So out of everything that we can possibly do, my opinion is to keep that airway as free as possible. Would you agree?
No, absolutely. I mean, if they cannot breathe, the eating, sleeping, all of that falls apart. So really keeping the airway open, using all the things we've discussed, is important. And if you're concerned and your baby is breathing in ways that you've not seen before, or seems listless or tired, or your intuition is going up, you need to escalate that to your pediatrician, or go to the emergency room or what have you, particularly in young babies. So again, your child better than anybody on the planet. And if something doesn't seem right, then you need to let somebody know.
Great, agreed. That's great advice. Okay, well, thank you for your time. This is an excellent discussion. I'm sure we will have more discussions in the future. If you guys have anything that you want us to do in the next discussion, please drop it in the comments under this video. We'll put something else together. And don't forget, go to Dr. Nosebot on Instagram. Oh, sorry, Dr. Nosebot. Sorry, Dr. Did I say Dr. Nosebot? Dr. Nosebest. And I'll put that in my comments. I'm sorry if I said that. Dr. Nosebest.
No, that's okay.
And to get more information about the Nosebot and Dr. Goudy as well, and to get some education, and let us know what you want us to talk about in the future. Again, use code BABYDOC to get $20 off. And is that case sensitive? Does it have to be all capital letters? I didn't ask you that.
That is beyond me, but I think it's capital
you probably
letters.
Yeah. So,
but I don't think it's case sensitive. I think it'll be fine. Yeah.
Okay. All right. Thanks, Dr. Goudy. Have a great rest of your day. I'm actually off today through Sunday, so yeah, I'm super excited. It's my anniversary weekend, so we're going to celebrate a little bit. So
good. Well, have a great time, and thank you for your time. This is super fun.
Yeah, thank you. We'll chat again soon.
All right, bye, y'all.
Bye.